Struggling with numbness, tingling, or pain in your hands? It might be carpal tunnel syndrome, and the right treatment can make all the difference. Whether you're looking to avoid surgery or just want long-term relief, today we'll explore the best diagnosis and treatment options that actually work. Stay tuned. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. If you're new here, be sure to subscribe for expert insights on staying healthy and active. Carpal tunnel syndrome is one of the most common nerve conditions we see today. It affects millions of people worldwide, especially those who work on computers, do repetitive hand motions, or even sleep in certain positions that put pressure on their wrist. If left untreated, it can lead to permanent nerve damage, muscle weakness, and even loss of hand function. But the good news, most cases don't require surgery. There are effective non-surgical and orthobiologic treatments that can help relieve symptoms and even heal the condition at its root. Today we'll cover what causes carpal tunnel syndrome, how is it diagnosed, best non-surgical treatments, including regen med options, when is surgery needed, and how you can recover faster. Let's dive in. Carpal tunnel syndrome occurs when the median nerve, which runs from your forearm through a small tunnel in your wrist, becomes compressed. This can lead to numbness or tingling in your thumb, index, and middle fingers, hand weakness, dropping objects easily or trouble gripping, and pain that wakes you up at night or worsens with certain activities. It's a progressive condition, meaning it tends to get worse over time if left untreated. But early intervention can make a huge difference. Several factors can contribute to carpal tunnel syndrome, including, first and foremost, repetitive hand movements. Typing, texting, using a mouse, playing musical instruments, manual labor, such as carpenters, assembly line workers, hairdressers. Number two is poor wrist positioning. Sleeping with your wrist flexed or bent, bad ergonomic setup at work can also lead to carpal tunnel syndrome. And number three are underlying health conditions. Inflammation from rheumatoid arthritis or autoimmune conditions within the wrist can lead to more compression on the nerve, leading to carpal tunnel syndrome. In addition, hormonal changes from pregnancy, diabetes, or thyroid disorders can lead to swelling, which then puts compression on the median nerve within the carpal tunnel. And then lastly, there's genetic and structural factors. Some people naturally have a smaller carpal tunnel, making them more prone to nerve compression. If you relate to any of these, it's important to start making changes now to prevent worsening symptoms. A proper diagnosis is the key to getting the right treatment. Here's how we evaluate carpal tunnel syndrome. Symptom check. Do you have classic numbness, tingling, or hand weakness symptoms? Does shaking your hand temporarily relieve symptoms? On your physical exam, we test your grip strength, wrist flexibility, and nerve sensitivity. Tunnel sign test. Tapping on the median nerve at the wrist, if tingling occurs, is a sign of carpal tunnel syndrome. And then there's nerve conduction study and electromyography tests, NCS and EMG tests. This measures how well your median nerve is functioning. If it's slowed, that is a sign of possibly carpal tunnel syndrome. And then lastly, there's some imaging. Ultrasound imaging. A high-resolution ultrasound can reveal nerve swelling, which is sometimes more accurate than traditional nerve testing on its own. If you have mild to moderate carpal tunnel syndrome, these non-surgical treatments can help. Ergonomic adjustments and wrist support. Adjust your workstation, keep wrists in a neutral position, use an ergonomic keyboard and mouse, wear a wrist brace at night to prevent bending while sleeping. Physical therapy and exercises. Nerve gliding exercises to improve mobility, stretching and strengthening exercises for wrist muscles. Then there's anti-inflammatory lifestyle changes. Reduce repetitive hand movements if possible at work or with activities. Try omega-3 and turmeric for natural anti-inflammatory benefits. And then there's injection-based treatments. Strongly recommend you do this without steroids. Avoid steroid injections. They provide short-term relief, but can damage tissue over time, and in fact, can sometimes make the outcomes of future carpal tunnel surgery worse because they damage the tissue. Instead, we recommend considering orthobiologic options like PRP, platelet lysate therapy, or prolotherapy. If conservative treatments don't work, regenerative medicine treatment options offer a safe and effective alternative to surgery. Platelet-rich plasma, or PRP, and platelet lysate injections should be considered. PRP uses your own healing factors from your blood to repair nerve damage. Platelet lysate is a more refined version of PRP, is more effective for nerve-related issues, and is actually my preference rather than just regular PRP. Studies show that PRP treatment can be more effective than steroids in treating carpal tunnel syndrome. Next, you've got prolotherapy for soft tissue support. By utilizing dextrose, you can strengthen the ligaments around the wrist and the carpal tunnel to reduce pressure on the nerve. We generally will combine prolotherapy technique with platelet-rich plasma and platelet lysate to obtain a better result. These treatments target the root cause rather than just masking symptoms. Mild to moderate cases of carpal tunnel syndrome generally do not require surgery, but in more severe cases, it may be necessary. In particular, if you have constant numbness and weakness, if there's significant muscle loss in the hand, and if your nerve conduction studies show extreme slowing of the nerve. The keys before you go for surgery are to, number one, get the right diagnosis. Make sure you don't have something like tendinitis or a pinched nerve in the neck that could be mimicking your symptoms like carpal tunnel syndrome. Number two, make sure you've actually maximized conservative treatments as well. And again, please avoid steroid injections. A much healthier and better option are utilizing your own blood platelets, platelet lysate, and prolotherapy. The key takeaways here are early treatment is key to avoid nerve damage. Non-surgical treatments like wrist support therapy and regenerative treatment options work well. PRP and platelet lysate offer a safe and effective alternative to surgery for mild to moderate carpal tunnel syndrome. If you're dealing with carpal tunnel syndrome, don't wait. The sooner you treat it, the better your outcome. If you found this helpful, make sure to like, subscribe, and check out chicagoarthritis.com for more expert advice. If you want to explore non-surgical carpal tunnel treatments, schedule a consultation today. Until next time, stay healthy and live well.